Hello everyone, welcome back to the channel M Pharma Trading Solutions. So today I'll be recording a demo presentation, how all others will be flowing, the other content that you have developed. So which I may upload in either a week, within 1 week, or I'll be maybe starting on 19th to upload them. So management of malaria. Malaria, of course, is a life-threatening disease, typically transmitted through a mosquito bite from an infected female Anopheles mosquito. And of course, the parasite is the plasmodium. We have falciparum. This one is the most virulent. Was common in Uganda. Vivax and Valley. This one is the one which can cause relapse malaria, because of formation of hypnozoids. Relapse malaria. Now, I want to talk about the life cycle of malaria parasite, of the plasmodium, but ensure at least you know it, because this is just a short presentation. But I'm sure later on shall make another one. Of course, the clinical features, we have the malaria can be asymptomatic or mild or even severe, or what we call complicated malaria. The stages, we have the cold stage. Patient feels cold and shivers. Hot, patient feels hot. Sweating stage, the patient sweats. The signs and symptoms. Of course, mild malaria, we have high fever, above the temperature, loss of appetite, malaise, headache, joint pain, muscle pain, dehydration, diarrhea, mild vomiting, enlarged spleen, and mild anemia. Now, in the severe complicated malaria, we have hyperpyrexia, of course, when the temperature is above 39 degrees Celsius, 39.5. Severe anemia, impaired consciousness, jaundice, vomiting, deep breathing. If you are pregnant, you can have uterine contraction, hypoglycemia, and very many others. I'm not talking about severe dehydration. I'm not talking about cerebral malaria. It's also there. Diagnosis of malaria. Of course, we use some, I don't know if it's still being used, the random diagnostic test. So it's common. Now, as a pharmacy professional, you have to know all these tests and even how to carry them. You have to know them. Now, microscopy or thick blood smear slide. Some lab people report +1 malaria parasite. It means that he has seen maybe 1 to 10 in the field. Now, those fields is when he's moving the microscope around the slide. But if +3 malaria parasite per 1 field, it means that by mere looking at through the microscope, he sees over 10 parasites in 1 field. Now, it means that this is what we call complicated malaria. Now, other presentation could be counted force per 200 leukocytes density. And of course, in a thin film, you count them against 2,000 red blood cells. Now, other tests which could be ordered, RBS, random blood sugar, hemoglobin, and of course, lumbar puncture if you suspect cerebral malaria. Now, how do you manage mild malaria? Of course, we use Artemisinin-based combined therapies, the ACTs. Or the first line treatment we have of malaria is artemether, lumefantrine, or what you call Coartem, Lumatem, this one, or any other brand which you have. Artemether, amodiaquine is a first line alternative, but we know, of course, these ones are all contraindicated in the pregnant women who are in the first trimester. Now, in the course of pregnant women, you can use quinine tablets or the artemisinin, piperaquine, duocotexin, pialaxin. I'm sure you're aware of those brands. The second line, others could be atovaquine, progranil, artemisinin, mefloquine, artesunate plus mefloquine. Now, the brands which you have, of course, you should be aware, and those which I've not talked about, because I'm in just a simplified presentation. I'm showing you how all others will be flowing in pharmacognosy, in pharmaceutics, in pharmacology, pharmchem, pharmacy practice. They will all be flowing like this. Now, management of severe malaria, we have the first line. We have artesunate. Of course, artesunate, it has the fastest clearing rate of malaria parasite. It can be used IV or rectal. Now in IV, the dose is 2.4 milligrams per kg for adults or 3 milligrams per kg for children. Now, alternative, we have artemether injection or IV quinine. The dose of this one, you can get them. Remember, this is a first presentation we are making to get comments. To get comments. Now, after a 3-day course, of course, you give ACTs or the quinine tablets. Now, the complication, I'll talk about a few of them, not all of them. We have hyperpyrexia or headache, joint pain. Of course, you know, if you're having high fever, we either use tepid sponging or we can use a damp cloth. Now, in headache, we give paracetamol, NSAIDs, diclofenac. Dehydration, we use IV, normosaline. Hypoglycemia, dextrose, 10% or 25%. I hope you know how to prepare this. Severe anemia, glucose matching, and transfuse whole blood or packed cells. Conversion, you can use diazepam or phenobarbital. The dose and everything else, get them. But there are other complications which I haven't talked about, because this is the first presentation that we have made. So, how do we prevent malaria? There are only 4 ways on how you can prevent malaria. One is by prophylaxis of vulnerable groups. For pregnant women, we give IPT, intended treatment therapy, where we use the Fansidar or the sulfadoxine pyrimethamine. In sickle cell disease patients, we give Chloroquine weekly. Tourists, they can use mefloquine weekly. Now, also, you can reduce mosquito-human contact. Now, by how? Sleeping under insecticide-treated mosquito net. Use of insecticide. Wearing long clothes to cover the arms. And use of repellents or the coils or sprays, all these ones. What we are trying to do in all these ones, we are either killing or we are preventing contact. So if they ask you how to prevent malaria, then you state only this one. This is just one point. What are you doing? You are reducing human-mosquito contact. Now, you can also control the mosquito breeding sites by removing stagnant water, burying any broken bottles or polythene bags, slashing the bushes around everything. Now, also patient education is very important in all the above. Now, this has been a short presentation. Our first presentation on how all others will be flowing. Just imagine now I'm presenting hypertensive, I'm presenting alkaloids, I'm presenting anything else. I'll be presenting it like this. Remember, this has been brought to you by M Pharma Training Solutions. I always remain Wilson. Subscribe to the channel in case you haven't subscribed. Like the video, leave a comment, and thank you very much.